Welcome to Career View. This is the podcast where we ask questions students want to know when it comes to pursuing a career path. I'm your host, Nirajit Sharmal, and each episode I will ask questions on behalf of students across the country from secondary schools and universities what they want to know when it comes to pursuing their dream job. For this episode, we'll be asking our top questions that have been submitted by students on our Career View website who are aspiring to become a physiotherapist. Now, to answer these questions today, we have 24-year-old physiotherapist Ella Burnage, who is currently working within the private hospital system, providing patients with care as they recover from major heart and lung surgeries. Now, Ella, like many people, found it very difficult in choosing only one specific career after finishing school, as she has a lot of different interests, but eventually found physio as the right fit for her. So, as always, let's get into it. Okay, so Ella, how's everything going?
Pretty good. Yeah.
That's great to hear. And, before we jump into our 10 questions, the first thing I want to know from you is, did you ever imagine being a physiotherapist? Did you ever imagine doing what you are doing today when you first, started school?
I didn't know. I had not much idea what I wanted to do during school. I was interested in so many different things, and I think the main thing I was probably interested in at school was more the creative side of things, which is not what I ended up going into. It took a bit of figuring out, definitely towards the end of school and after school, to figure out where I wanted to go. That's
really interesting, and I really want to explore that as well, because you're in a very specialised field. But before we do that, let's get into our questions on the career choice of a physiotherapist. And the first question that we have here, Ella, is what does a brief day in your life look like as a physio?
So I work in a hospital, so I work in the medical inpatient wards. And at the moment, I'm working on a cardiothoracic ward. So in the morning, me and my team of physios, which is usually about 6 of us, will meet up and see who we need to see for that day throughout the hospital, and we'll basically split the patients up. And then I go to my ward and we'll do a handover with the nurses, doctors, allied health, so social worker, OT, and basically discuss all the patients on my ward and see where everyone's input is needed, and just to hand over anything that you've noticed within the last 24 hours. And then you just get into it, you go through your list and see all the patients you need to see on the ward. And then if anybody needs help in other wards, then I'll also go to different wards and help out the other physios as well to see everyone who needs to be seen within the hospital.
Wow.
Yeah.
So, and typically what do your hours look like, and is that a normal during the day kind of work?
I think for physio, which is one great thing about physio, is that you do have quite good hours. I just have 8:30 till 4:30 usually. And I mostly work Monday to Friday, a weekend every probably 2 months. So, yeah, I'm quite lucky, but not every physio job is like that. Okay. A lot of physio jobs are a bit more variable.
Fair enough. Next question that we have for you, Ella, is how did you decide on which specialisation you wanted to focus in?
That's something that I'm still figuring out. I wanted to go into hospital because I just thought it's a good place to start off. There's so much variety. There's so many very experienced people there to learn from. And I didn't want to jump straight into a private practice job. I wasn't really that interested in the classic sports physio. So, yeah, that's why I went for the hospital rather than a private practice. My job at the moment is I do a lot of chest physiotherapy. So after big heart and lung surgeries, you'll make sure that they're basically getting air into the lungs and they're clearing what they need to clear, and getting people up and moving after surgery. So a side of physio that I had no idea about when I first started my degree, basically.
Yeah, that's so unique. So why did you focus on the chest area? Was that a specific, you just fell into that, or you just found that interesting, or is this right now just what you're doing at the moment?
Yeah, so at the moment we do 3-month rotations through all the medical wards. So I've just started on this ward a month ago. So yeah, I think it's a good base to have. You need to know that as a hospital physio. I don't think it will necessarily be what I end up doing for the rest of my life, but I think it is a good thing to have knowledge about. So, yeah. Really
good to know. Next question, Ella, that we have for you is, did you struggle to land a job after completing your degree?
After I finished uni, I took a few months off, went on holiday, and just had a bit of a break. And then I was quite stubborn. I knew that I wanted a hospital job, which is hard to get as a new grad. But I basically just only applied for hospital jobs that I wanted, and it did take a bit longer to get a job, but something ended up coming up. So I'm glad that I waited for something that was actually for me.
And how did you go about applying? You just applied online, or was there any other additional things that you had to do? How did you find the whole interview process? Like, what was the different steps to get in the hospital job and do this rotation work that you're doing right now?
So if you go for a public job, you apply usually through Jobs WA, which has all of the advertised public hospital jobs around Perth and also in the country as well. So the application process is quite a long one. You've got to do your resume and you've got to do your cover letter as a usual job, but you also have to do a whole lot of different questions. But I actually went into a private hospital first, so a way shorter application process, and it was just quite lucky that it came up. One of my friends was working at a hospital nearby that was associated to my hospital, and I applied just directly to the hospital, just sent them my cover letter and my resume, and ended up getting a job that way. So yeah, there's definitely different ways to get into the job that you want to do. I know people who've turned up and just given in their resume and got a job on the spot. So all different ways.
It all varies. Yeah, absolutely. No, and I'm glad to hear that it did work out for you. Next question that we have for you is, how long do you have to practically train before you can be independent in the workplace?
Yeah, I mean, being a hospital physio, you'll usually have a little bit of shadowing and learning for the first few weeks, but you'll basically be thrown straight in and then just asking questions when you need it, asking for help when you're not sure. So I was independent in the workplace probably within a month of first starting my job.
Wow. Okay.
But you'll just ask for help when you need, if there's tricky cases come up or something that you're not sure about, which obviously will come up all the time. But yeah, you kind of lead the way and do what you want with your patients, basically.
Oh, absolutely. So very quickly, you're getting the responsibilities and the roles of handling patients and being actually quite independent in terms of handling all day-to-day activities.
I mean, I guess your fourth year of uni is five-week pracs. So you'll be in there dealing with a full patient load by the end of your pracs. So you should use that introduction to kind of learn. It's not like you're just going straight into the job without any practical experience. So you've got that behind you. So yeah.
No, really good to know. Next question, Ella, that we have for you is, what did you find really surprising about working in the role? Is there anything that really shocked you that you're like, wow, this is not what I imagined or expected at all?
I guess the variety, definitely. I didn't know about so many different areas of physio. I guess you usually just think of the classic sports physio that you would go to as a kid, but I had no idea that there's physios in hospital, there's physios in quite niche areas like women's health and vestibular. I just had no clue about all those different roles. And I think the other surprising thing that I would also found was probably the salary. I think that we kind of associate physio with being quite a highly paid job, but I don't think that's always the case.
Interesting. I'm keen to explore that a little bit later because it's one of our questions that we come through. But before we jump into that, the next question that we have for you is, how hands-on is the job?
My job is definitely very hands-on. You're face-to-face with a patient most of your day. And yeah, that would be for my job. But there are a lot of different jobs as well if you don't want to be so hands-on. I know people who have realised that they actually don't really like that hands-on, always with somebody side of their work, and they've gone into different areas like being a tutor or a lecturer or research or occupational health and safety, where they're doing, work site reviews, that kind of thing. So there are different areas you can go into if that turns out not being for you. But I think that if you're going into physio, I would be wanting to be hands-on because that is the larger proportion of physio.
Yeah, no, well understood. Next question that we have for you, Ella, is does the career role of a physio, does it have steady pay?
Yeah, so as a new graduate, I think I started on probably 60,000 excluding super. And if you were in the public system, you'd probably be starting around 75. So it is a pretty good entry-level graduate salary, but I think that the jumps is just not as big as it is in other areas. So if you were in more of a business type workplace or a consultant type workplace or something like that, you might see those bigger jumps. But unless you're owning your own private practice or you're climbing up the ladder in the hospital and getting into more management, the pay doesn't jump up a whole heap more. So I think as a physio who's working in a hospital, you probably wouldn't be getting more than, I reckon, 110 grand if you're staying clinical.
Yeah. How does it work for you? Like, do you find that kind of money is sufficient for what you want, or are you looking down to maybe doing clinical and having your own practice to even look at even a higher pay scale?
Yeah, I mean, for me, I think if I was to get into the public system, I'd probably earn more, and you have those increments that you go up by. But if you're working for a private company or a private practice, then of course the business side of things is there. So especially if you're not as experienced, you're not going to get paid as much. At the moment, I think if I could get into the public sector at some point and just have those steady increases, I would be happy with that. But I know that some people would not, and you can definitely go down the route of trying to make a bit more of a business and owning your own private practice. And a lot of private practices, you'll get paid by commission as well. So if you are seeing lots of patients a day, then you're going to earn more. So there's a bit of variety between what job you go into with a physio with the pay.
Really interesting. And just last one on the pay side of things, when you talked about increments over the years, what does that look like? What is specifically, approximately, do you see in both the public and private sector for a hospital? What could that potential increase be over the years? Would you have an idea on that? Yeah,
so I think in the public sector, friends I have in the public sector who are in their third year out of uni are earning about 88 grand a year excluding super, and I think the maximum I'm estimating here, but I think it would be around the 110 grand if you're still a level 1 physio. If you go into a more senior position, which can take years and years down the track, then it might be a bit more than that, but that's for the public sector. Private sector, it usually turns into commission based. So when you first start off as a new graduate physio, you'll be getting less of a proportion of the money that everybody's paying to come and see you, but then that proportion usually increases as you become more experienced. So I don't work in private practice, so I'm not exactly sure what that figure would be, to be honest.
Fair enough. Ella, last question that we have for you is, what do you find rewarding about the role, and what do you really take out of it? And at the end of the day of completing your work, what is the most satisfying thing about being a physio?
I do enjoy being at work. I don't finish work usually and think I hated every minute of that day, you know what I mean? So, yeah, I mean, you are helping people. You definitely are appreciated. It's directly impacting someone. So, yeah, it is definitely a very rewarding job. And I think also working in a team, especially if you're in somewhere that's quite rehab-based and you're working with OTs and speech pathologists and social workers, and you're all kind of going through that journey of a patient when they first come into hospital until they leave, working in a team and seeing their progression is really rewarding. So, yeah, definitely one of the best things about the job.
Really great to hear that, Ella, and thank you so much for your honesty. And that wraps up all the questions that we have for you today. For our listeners who have more questions for Ella and that did not feature on our list, just visit our website, careerview.com.au. This is where you'll find Ella's profile. You can email with more questions and she can answer them over there. Please don't forget to submit more questions that you may have to our young career professionals who've been there, they've done that, and can share their experiences with you. Ella, probably the last thing I just wanted to ask you, you touched upon very early on, is that you didn't really know what you wanted to do. You looked at a number of different options. You were in the creative side of things. Is there any part of you that may look at other things later on in life, or are you pretty happy with where you are today?
I think for now I'm happy. I think out of work I try to be as creative as I can. I do pottery and I try and get a bit of art in where I can. But I think, yeah, working full time is quite tricky to fit that all in. And I mean, I guess you've got to make a choice. If I went into something more creative, I guess it was a bit more risky, and I was scared that I wouldn't be able to do other things that I wanted to do in terms of travel and having enough money to do that, or just being a bit, I guess, stressed about not having enough money to support myself. So, yeah, I think that physio I really enjoy, and it allows me to do what I want to do. And who knows, maybe later on I will pursue something a bit more creative, but we will see what happens. I'm happy for now.
We'll see, and really happy to hear that, Ella. And thanks again for being on the show.
Thank you.